My name is Mike, age 62, and I came in because I was having some hip pain, some knee pain, and some back pain with walking, that type of thing. Trying to jog or walk it, really I had to stop. I'd start doing it, then I'd quit doing it for 4 or 5 months, go back and try to walk or jog again, then I'd end up with hip pain, and just pains when I tried to sleep at night, that type of thing. Probably this has bothered me off and on for probably 15, 20 years. And I had done a couple of different things to try to get relief. I visited a doctor, an orthopedic doctor at one time, and he told me, well, you've got some degenerative things in your hips. You're probably going to be a good candidate for hip replacement down the road, and take some ibuprofen. The doctor I go to probably, he told me, well, run on a softer track or take some ibuprofen, that type of thing. So those types of things I tried. Stretching, I had a inversion table I bought, tried that, hanging upside down, some different things. I found, I guess, number one, the people to be very helpful and very compassionate and really let you know what was going on. I was a little, I guess, apprehensive, number one, to go to a chiropractor, only because when I saw a neurosurgeon, the neurosurgeon suggested looking at chiropractors can be good, but right now you've got a lot of swelling in your neck, you don't want to manipulate it. So for that reason, I really kind of avoided a chiropractor. So I didn't really know what to expect, but what I found is that it, through the process, through the exercise, the adjustments, that type of thing, it really helped relieve my pain in my back and my hips. I completed the program about 2 weeks ago. And I would say up until about 6 weeks ago, still was not going out doing long walks or jogging or anything. But the pain was gone in my hips, and I could sleep at night, not have any pain in my hips or my back. And about 4 weeks ago or 5 weeks ago, I started doing the walking again. And I've actually started doing some jogging since then. And I've gotten up to where I'm doing between 4 and 7 miles a day with that. And it's a walk-jog combination, and still have no hip pain or back pain from that. So I can go to bed at night, no pain with it, that type of thing. So it's been very beneficial.
That's all.
I think it was absolutely worth my time and money. My insurance covered a great deal of it, so that worked out very well. I would definitely refer somebody and would recommend anybody if they're having back pain or really any kind of pain.